Welcome. We are now ready for our lesson 3 in our course on generational trauma. And in this lesson, we will look at childhood trauma and its relationship to generational trauma. So glad you're all still with me, and I hope that you're finding this to be an enriching experience. So if you're ready, I'm ready, and let's get started. Pull up the old PowerPoint. All right, here we go. Once again, the title of our course is Healing Generational Trauma, Paving Your Path to Wholeness. And we're just going to skip right ahead to today's lesson. Defining the link between childhood trauma and generational patterns. So that is our task today that we have in front of us. So just an overview of what you can expect from today's lesson. Getting lost with my notes. Yeah, what you can expect from today's lesson is that we are going to explore the profound connection between childhood trauma and the emergence of generational patterns. We're going to examine how the experiences of childhood trauma can influence family dynamics, behaviors, and coping mechanisms across the generations. By gaining insight into this link, we can begin to understand how our own experience can help us work towards breaking the cycle of generational trauma. So just a little quick review. If you want a more in-depth review, feel free to look back at previous lessons. But just a quick one to keep us rolling forward. We've learned that what trauma is. It's that painful and disruptive internalization of a difficult experience. We've learned what generational trauma is. We know that generational trauma refers to the transmission of the psychological and emotional effects of trauma across multiple generations within a family and or community. We've also learned about the signs and symptoms of generational trauma. So those were emotional, mental, physical changes that are related to or caused by the event and its associated trauma or by connection with a parent who experienced the event. So we're going to jump forward here and also review the signs and symptoms of trauma and generational trauma. The big categories of signs and symptoms are emotional or physical manifestations. Examples of that are fearfulness, excessive anxiety, lack of motivation, persistent sadness. Behavioral symptoms, examples of that are substance use, self-harming or self-destructive behaviors, and relationship difficulties. And then, of course, we have somatic symptoms. Those are the bodily symptoms. And that might look like chronic pain, gastrointestinal problems, and or autoimmune disorders. So once again, if you need a more in-depth review, please feel free to rewatch the previous lesson or just revisit the part you need to review. That is one of the benefits of taking a course in this format, is you can do that anytime you like. And you can review any part of it as many times as you need to. This can be some really dense material if you haven't already been learning about these kinds of things. For some of you, it's more of like bringing together some concepts. And for others of you, all of this is new. So absolutely, I want you to tailor this to your learning experience. So looking at our learning objectives today, they are understanding the relationship between childhood trauma and generational patterns, exploring the intergenerational transmission of trauma and its impact on family dynamics, identifying common generational patterns that emerge from childhood trauma, and examining the ways in which generational patterns affect coping mechanisms and behaviors. You'll see all of those there. And today we have a picture of that I really love of the gingerbread people. Sometimes I look at it and think there's just this one sad guy here in the middle. So maybe that gingerbread person is depressed and the others are not. Today, it looks to me like generations, like maybe this is the first generation and the second generation, the third generation. Maybe this is you, even though you're experiencing some difficulties related to what happened before that we cannot see yet. You're trying to figure it out, and through the process of figuring it out, make for a happier third generation. I hope that's how the story goes anyway. So let's see, let's jump into our topic today. So defining childhood trauma. It's the same but different. So childhood trauma happens when children are exposed to events that overwhelm the child's capacity to cope. And that could look really different from things that would be likely to cause a trauma wound in an adult. Events that where the child doesn't have sufficient help or support to interpret the event, and thus are forced to deal with it alone or with insufficient support, get internalized in painful and negative ways. Think about a broken leg that doesn't get medical attention. It'll grow back, but it may not be aligned correctly, and thus it may cause quite a bit of pain and difficulty performing the expected function. In this example, walking, there may be a lot of difficulty performing in the usual or expected way. There's a great quote from Dr. Gabor Mate's work, which reminds us that children don't get traumatized because they get hurt. They get traumatized because they're alone with the hurt. So for any of you who have children or plan to have children and are worried about traumatizing them, just know unexpected and overwhelming events will happen, but it's about being there to support and help the child contextualize and work through what is happening. We can't prevent life events, but we can help each other through those life events and be better for it. Other things to think about when defining childhood trauma, types of events that tend to cause childhood trauma, physical abuse, neglect of basic needs. Those might be food, water, clothing, shelter, medical needs, sexual abuse, emotional abuse. And here's one that a lot of people don't know produces trauma wounds in children, is not experiencing closeness or connectedness in their family. So we've all seen a family where the kids just seem to try and essentially take orders from the parents, and there's not a lot of emotional closeness or emotional expression. And that has its own impacts for children. Part of being a child is learning to identify emotions and manage those. And previous generations, there wasn't a lot of space for that. And so that gets passed along. Another example is experiencing long-term, sudden, or ill-timed separation from a parent, witnessing violence. Going back to Mark Wolyn's book, It Didn't Start With You, he describes his own experience of his mother being in the hospital for a month, just right after he was born, and feeling like that's where his abandonment wound started. And of course, the example I gave last time of the children left behind in China. You know, it's certainly impactful for a 10-year-old to be separated from their parent, but it's impactful on a vastly different scale for a 6-month-old to be separated from their primary caregiver or mother. that is a much more impactful experience for the, most children. That would be the case. And then, of course, another thing to consider when thinking about what childhood trauma is we want to look at the short-term and long-term effects. So the emotional, the cognitive, and the behavioral consequences. Cognitive being how we think and what we think about ourselves, the world, our place in it, how the world works. All of those are a pretty big deal when it comes to looking at childhood trauma wounds. So this whole lesson is on the relationship between childhood trauma and generational patterns. So what are generational patterns? Generational patterns refers to reoccurring behaviors, beliefs, and coping mechanisms that are passed down through the family line as a result of childhood trauma. There can be healthy generational patterns as well, but those tend to be less noticeable because they're working and they're effective, and they're what you hope to see. So with the intergenerational transmission of trauma, mechanisms of transmission, we want to explore the ways in which trauma can be transmitted across the generations, including through a parent's behavior and family systems and attachment styles. And I know I'm throwing a lot of big words at you, but again, you can review this anytime, and the resources that I have laid out for you today will hopefully help in breaking some of this down. But first, I'm going to explain about intergenerational transmission of attachment styles. So some of you may have already done some reading on attachment styles. If you haven't, there's a book listed in the resources for you. But the main types are, and some of these are broken down into subtypes. I'm just going to touch on the main types today. They are secure attachment, which is considered to be the healthy, most desirable type of attachment, or the type of attachment people hope to get through a healing process. And then there's also anxious attachment and avoidant attachment patterns. So attachment styles are psychological frameworks that shape how individuals form and maintain emotional bonds with others, particularly in their closest relationships. These styles are established early in life, often during infancy and childhood, early childhood, and they play a significant role in shaping one's interpersonal interactions, self-perception, and emotional well-being through the lifespan. So let's hear about this amazing secure attachment. Secure attachment is the foundation of healthy relationships. Secure attachment is considered the optimal attachment style. Individuals with a secure attachment style tend to have a positive view of themselves and others. They feel comfortable expressing emotions and seeking support from their loved ones. Securely attached individuals believe that they are worthy of love and that others are generally trustworthy. So here we go with that, how individuals see themselves, how they see the world, how they see other people in the world, how they believe that the world works. So in the case of secure attachment, these individuals they believe that they're worthy of love. They see others as generally trustworthy, and their relationships are characterized by openness, effective communication, and a sense of emotional safety. Secure attachment is often nurtured by consistent and responsive caregiving during early childhood. Caregivers who meet the child's emotional needs, provide comfort when it's necessary, and create a secure base for exploration contribute to the development of a secure attachment style. So that means being there with the child, but allowing the child to explore the world, knowing it's safe to do so. I've got an eye on you. And when studies have been done of these attachment styles, what it looks like in a small child of, say, two or so years old is the child will play kind of near the mother, but not on top of her, and will look back and check in. They'll get wrapped up in exploring what they're doing with their toys or whatever's happening, but they will periodically check back in. Is mom still there? Hey, mom, watch me. Look at this. Checking back in to remind themselves, I'm adventuring, but I'm safe. And that's what secure attachment looks like in a little one. And of course, we've described a little bit here about what it looks like in adults. It's that openness, effective communication, and sense of emotional safety. So moving on to the other broad categories of attachment styles, we have anxious attachment. So the anxiously attached person will be constantly seeking reassurance. Anxious or preoccupied attachment is characterized by a strong desire for emotional closeness and a fear of abandonment. Individuals with this attachment style may be overly concerned about the status of their relationships, may constantly seek reassurance and validation from their partners. They often worry about rejection or being left alone. This attachment style can emerge from inconsistent caregiving during childhood, where the child's emotional needs are sometimes met, but not always, and it's not predictable when they'll be met and when they won't. As a result, individuals with anxious attachment style may have difficulty trusting their needs will be consistently met in their adult relationships. So they'll be checking in almost constantly. So in studies that were done with small children and their mothers, this would look like the child who doesn't want to leave mom's lap, or who wants to be always very closely touching mom in order to play. That's what that would look like visually in a small child. And then, of course, we have described what it would look like in adult relationships, which is kind of just that internal worry about the status of the relationship. Are we okay? Are we good? Are you mad at me? And also the checking in with the partner. Those are ways of checking in. But there's the internal worrying, and then also the behaviors that go with it, which might be the constantly seeking reassurance or validation. Moving on to avoidant attachment, sometimes called dismissive attachment, and this comes with a fear of intimacy. So individuals with an avoidant or dismissive attachment style often prioritize independence and self-sufficiency in their relationships. They may be uncomfortable with emotional vulnerability and tend to downplay the importance of close emotional bonds. They may have a fear of dependency and prefer to maintain distance to avoid potential emotional pain. Avoidant attachment can develop in response to the caregivers who are pretty consistently unresponsive to the child's emotional needs. So when a child bids for closeness or attempts to get attention are met with rejection, or ignored or neglected, they may develop a defense mechanism that emphasizes self-reliance. So they kind of stop seeking it. At some point, they will just handle things on their own. And that's in small children and in adults. There'll just be a lack of connection, lack of communication, just a belief that I'm alone in the world. I have to do everything myself, and I cannot rely on others either to help me with my emotions or anything else. There's another, I'll call it a breakdown of the avoidant category. So there's avoidant dismissive and avoidant fearful, those being subcategories of the avoidant attachment style. And it looks like navigating conflicting emotions. Sometimes it's been called disorganized attachment. But there's fearfulness, avoidance, and it's often marked by a blend of anxious and avoidant behaviors. Individuals with this attachment style often experience a lot of internal conflict. They want the emotional closeness, but they're afraid of it at the same time. They're afraid of the potential pain it might bring. So they struggle with trust and they oscillate, kind of, like that oscillating fan going back and forth between seeking connection and pushing it away. It's a very intense dynamic. I want to pull you super close and then push you very far away. Fearful attachment can arise from traumatic or abusive experiences during childhood, where the primary caregivers were both a source of comfort at times, and then at other times they were themselves dangerous. The resulting confusion can lead to a complex and ambivalent feelings about close relationships. So, like, there's an understanding there that comfort comes from close relationships, but at any time it could also hurt me, which is very confusing both for children and for adults. And that's the attachment style that tends to cause people the most problems and benefit the most from some work on dealing with the trauma from which that came. So just to wrap up this part about attachment styles are significantly influenced by how individuals form and maintain relationships, impacting everything from communication to just emotional well-being, to feeling okay in your own skin. And recognizing one's own attachment style and understanding those of significant others can provide insights into relationship dynamics and potential areas for growth. Importantly, attachment styles are not fixed. They can be influenced by later personal experiences, by therapy, and by just reflecting and increasing your self-awareness of the dynamics that can be playing out internally in your relationships. By understanding attachment styles, individuals can work towards building healthier and more fulfilling connections and fostering emotional resilience. So I would never say that secure attachment is the optimal position if certain people were doomed to never get there, but that is not the case. It's a healthy state that can be worked towards. And so people in any of these other attachment styles currently can heal from the trauma that caused these attachment styles to develop and move towards secure attachment. And maybe you don't get into 100% secure attachment all the time, but if you can get to like 80, 85% securely behaving as a securely attached person and securely attached in your primary relationships, there can be a lot of healthy, good stuff coming from that. So the next thing I want to talk about under the heading of generational patterns is the impact on family dynamics. So honing in on understanding how childhood trauma can influence family relationships, communication patterns, and power dynamics. Childhood trauma exerts a profound impact on family dynamics, shaping the intricate web of relationships, communication styles, and power dynamics within the family unit. The effects of childhood trauma can reverberate through generations, altering the way family members interact and connect. Communication patterns often bear scars of trauma. Silence, like giving the silent treatment, avoiding conflict, or aggressive communication, like yelling at each other or, insulting each other, talking down, judging, blaming, can emerge as coping mechanisms, hindering open and healthy dialogue. Power dynamics within the family can become skewed, with some family members assuming controlling roles while others withdraw or pull away. Family relationships may suffer as trauma can disrupt trust and emotional intimacy. Unresolved trauma can perpetuate cycles of dysfunction, impacting parenting styles and perpetuating destructive behaviors. Recognizing these dynamics and seeking professional help can pave the way to healing, and foster improved communication, mutual support, and healthier emotional bonds. So some common generational patterns are repetition of abuse. So the tendency of individuals to perpetuate abusive behaviors learned from their own experiences of childhood trauma. I think everybody has seen this in some person that you know in your life where it just seems like they are mechanically repeating what they grew up with no insight or thought into whether they want to or should be behaving in that way. They just do. And you know it's what they grew up with, and you'd like to see them change it, but they've just given no thought, and they're just acting that out exactly as it happened when they were raised. Another common generational pattern is avoidance or withdrawal. That looks like trauma that can lead to emotional withdrawal, isolation, and avoidance of conflict or intimacy in relationships. So these might be people who just don't start a family because they don't know how they would work these things out. They isolate themselves socially. If they do have relationships, they're not very emotionally available or present in those relationships. Another type of generational pattern is hypervigilance and control. So here we want to look at how hypervigilance, control issues, and a need for external validation develop as a coping mechanism in response to the trauma. So this might look like people who really want to make sure that their painful experiences are not repeated. And so this there's an attempt to control everything to make sure that the trauma is not repeated. But it's too much. It's more than is healthy for the family or for the child, and kind of results in its own problems that come from that. Excuse me. Another type of generational pattern is emotional distress. So that is just where the childhood trauma causes anxiety, depression, or just a heightened or chronic stress response in the parent, in the child, and that just gets passed down. So there's not any sense of like, I don't know what we're anxious or depressed about. This is just how we are as a family. These just ways of being in the world get passed down. And then another important generational pattern that shows up in families where there's trauma is communication challenges. So difficulty expressing emotions and establishing healthy boundaries. In a family where there was neglect or abuse, it may have been unsafe to express emotions, or, perhaps the child wasn't allowed to have boundaries. Maybe it wasn't safe for the child to say, I don't like this, or I do like this, or I want more of this. If those things weren't safe for the child to say, then they're not going to get any experience setting boundaries with other people. The other important part of what we're learning today in terms of intergenerational transmission of trauma and generational patterns is coping mechanisms. So how does anybody learn how to manage life. That's what coping mechanisms are, just how we developed a way to manage life as children. And we tend to use the word mechanisms to imply things that they may be good or bad or neutral. And we tend to use coping skills when we're talking about something that's definitely healthy, or 99% of the time will be a healthy thing. So coping mechanisms can be things like substance use, addiction, understanding the link between childhood trauma and the increased risk of developing substance use or addiction is going to be really important for families affected by that. The correlation between childhood trauma and substance use later in life, or addiction later in life, is closer or more correlated than the connection between obesity and diabetes. So more than 2/3 of individuals who get treatment for addiction report experiencing childhood trauma. Other coping mechanisms and behaviors that develop are self-destructive behaviors. Those can be patterns of self-harm, anything risky. I was listening to an interview with Steve-O from the Jackass series, I believe is what he's from. I didn't watch any of those, but I was listening to his story. And he described this just lifelong pursuit of risky behaviors and addiction. And I think we can see that even from this 1-hour interview. It was pretty clear to me, with what I know about generational trauma, that this developed out of attachment issues and generational trauma, even though he did not identify it that way. What he actually said was he was just born that way, and nothing that happened in his childhood influenced that. That's different than what I know about trauma. So also engaging in toxic relationships can be a maladaptive or unhelpful way of coping with childhood trauma. So we use the word maladaptive to indicate that in some ways it seems to work, but in other ways it causes much bigger problems. So the overall assessment of, is this working in my life or not, really has to be, it's not working, but it's a holdover from childhood patterns. And then the last type of dysfunctional coping mechanisms that we'll talk about today is just emotional dysregulation, of not being able to manage emotions when they come up, having frequent mood swings, anger outbursts, difficulty expressing what you're feeling, and then a real severe difficulty managing those emotions. All of these come out of certain types of childhood trauma. And so everything that I've described today are these big constellations or groupings of symptoms and behaviors and patterns, and your particular family's symptom, behavior, pattern may look like only 1 or 2 or 3 of these things. There may be this kind of attachment, which led to this kind of behavior, and then this kind of emotional dysregulation or a substance use pattern. So what I'm presenting here is kind of all the possible scenarios at once. So part of our journey as we go forward will be helping you to sort through and figure out which one of these are useful or meaningful for me and my family, and better understanding where I've come from and where I'm going, and how I can best help the next generation and myself. So that's it for today, lesson 3, wrapping it up. I do want to touch on the resources that I have for you. Let me just click over here so we can see those. Yes. So the lesson 3 resources are a book And yes, it's on attachment. It is called Attached, the new science of adult attachment and how it can help you find and keep love. So that's all kinds of love. All kinds of relationships have different kinds of love in them. So it kind of sounds like a dating book, but it isn't. It isn't. It isn't. I'm going to jump down here to the activity. This is the Adverse Childhood Experiences Scale. This is a super quick questionnaire. It's 10 questions, and it can help you kind of check off like how many of these things that I experience. And I'll throw out a fact for you. People who score over 3 are like 10 times more likely to struggle with substance use and other problematic behaviors. So if you scored more than a 3, just know you're dealing with some hard things. And that's why life feels hard, is because it started out hard. And then we'll move on to this journaling prompt. So what I want you to do for this is complete the questionnaire. And then you will probably naturally want to reflect on what that means. So think about those experiences that you lived through. Which ones impacted you the most? What are some things you learned from during these experiences? How are those things you learned positives in your life or negatives? So for instance, just to throw out an example, your parents got divorced and you had to get on the train by yourself to go see your father in a different city. Not everybody's experience, but we're mainly concerned with your particular experience. So let's say that was your experience. And then the negative is, of course, the separation, the times where you weren't together, feeling, internalizing any negative thoughts like, if I was better, they'd still be together, things like that. But then also maybe there was some positive independence and competence that you got from riding that train by yourself. Maybe you made a friend on the train and that ended up being a lifelong friend, and that was a positive experience. So it's good to reflect on things in terms of the whole experience rather than just how it was painful. And if it was only painful, then that's reality. That is what it is. So I hope you take some time to utilize these resources and interact with those as much or as little as feels useful for you. I'm not grading this. You don't get any points for doing it. It's just your healing journey and what you need to feel like you're getting your needs met and moving forward and learning and growing. That's the whole point of this course and what we're doing. So I will ask you one more thing to do in between now and the next lesson is take good care of yourselves. Seek support as you need it to work through these things. You may need to talk to a friend or your own therapist or, just other people who kind of know about these things. That's an important part of this as well. Alrighty, well, I will see you in our next session.